Nick Eubank and his associates and the Sydney Dehaan Research Centre conducted a research project that was funded by the Arts and Humanities Research Council. And the nub of curiosity with this project and all of those under the Cultural Value Project was really thinking about how we talk about arts and culture in the context of health and well-being. And this question reflects, I think, the aims of this project. We chose to work in 3 areas in coastal towns that are being regenerated, and we focused on Margate here in Bexhill and in Folkestone, and we'd like to thank Victoria and Karen from the Turner Contemporary, and Stuart, of course, and Sally Ann from here, and Alistair Upton from the Creative Foundation. We approached the project with a focus on this overarching question. We couched it slightly differently in our application to the Arts Council, but what have the arts ever done for us? And we wanted to look at these main themes. Do the arts engender reflective individuals? Do they engage citizens? Do they engender urban regeneration, community dynamics, and improvements in health and well-being? And Tigger is here to just remind us of the importance of resilience, and it's something that both Baroness Andrews and Stuart have spoken about already this morning. So as with all good research, we thought we should start with a mapping of literature of what we know or what we think we know. And I think this is reflective in what Stuart's already talked about. We know, or we think we know, that cultural activity leads to social capital. Social capital, we spent quite a lot of time exploring the definitions of social capital, and we quite liked this very simple definition given by John Field, who is a professor of lifelong learning, and it's simply that relationships matter, and we can take that in all sorts of contexts: individual, community, social, national, and global relationships. So people connect with one another, they share common values and interests, and they collectively build a platform for reciprocal benefit, positive benefit. Once social capital is established, there follows some resilience, one would say. Healthy individuals who take an interest and pride in their community. And that leads to overall healthy communities, and in turn supports perhaps healthier economies, which is likely to both reflect and respond positively to cultural activity. But of course, this is not always a very simple picture, and we're lucky to have some people talking a little bit later about the co-factors and the complexities of looking at causality. In addition to understanding more about social capital, we're also really aware of the evolving definitions of health and well-being. A sense of good health, or a sense of good well-being is determined by a whole raft of cofactors. And this goes far beyond the oft-quoted section of the World Health Organization's definition of absence of disease. We rather like this quote from the World Health Organization's Health for All strategy that was written in 1981. Health is created and lived by people within the settings of their everyday life, where they learn, work, play, and live. So in the context of cultural offer in the 3 coastal towns, could we take these relationships, could we take the understanding about social capital, our understanding about health and well-being as given? Could we answer these questions? What can we measure from cultural impact on health and well-being in the towns? Can social capital theory and social network analysis help to complete a tapestry of understanding in relation to health and well-being? And is there potential for cross-fertilization in understanding what might take place between cultural organizations and academic researchers that might inform policy? Stuart's spoken about the previous research that Nick Eubank and associates undertook here, A Generation for Social Capital, and we chose to use that model as a design, which proved to be very successful. It was slightly adapted. It was based on the Design Council's Double Diamond DOT Designs in Time process model, and because it was such an integral part of what we did, we've produced an appendix to the final report that goes into quite a lot of detail about how that was undertaken. We used, you can see here, the triangulation of methods, the list of methods, and the participants included people who have a really good handle on national and regional cultural policy and an expertise in health and well-being, and really importantly, members of the public, people who stepped foot in cultural organisations, and people who took part in group activities in these organisations. So just to give a really quick whistle-stop tour, I just sort of plucked some of the key findings that I think are probably quite important. The study showed that in general the process of the methods was an outcome in itself. The taking part, talking about arts and culture in relation to health and well-being was a very interesting and important way of engendering new thinking, new notions around culture and health and well-being. And it did in fact result in new discourses and a number of new questions. So the study showed that in general, the participants there was a conviction that cultural engagement had a very positive effect on health and well-being. And if I could just quote one artist who said, "Whether they like it or not, cultural organisations are social objects. They're places where we make social capital." But of course, this is as yet undefined, unqualified, one might say. Amongst the providers of arts, there was a significance of social value, and practice was seen quite variably. And it ranged from it being a primary influence to their programming to being an unintended or accidental byproduct of their programming. And if there is a reluctance on the part of cultural organisations to centralise health and well-being as part of their mission, it was probably because it's implicit anyway. We know it works. There's plenty of anecdotal evidence that it does work. The kind of, if it ain't broke, don't fix it attitude. In terms of effect, active versus receptive participation, the confounding factors were what we see in the literature. So nothing new there, really. The broad range of motivations why people step into cultural organisations, the complex spectrums of their experience and their individual perspectives. So the good news was that the majority of participants saw a link, a symbiotic link between the effects of culture and social capital and health and well-being, and that was directly or indirectly. Many of the participants expressed advocacy in an abstract way, talking about feeling good, springing your step, the community working together, those sorts of comments. Interestingly, no participant referred to any defined model of health and well-being, and Stuart's already talked about the 5 ways to well-being. Intuitively, there was quite a lot of connection between amongst commentators about the effects of health and well-being on the New Economic Foundation. For example, 5 ways to well-being, taking part, being active, taking notice, learning and giving, and certainly in terms of reciprocity. And in addition, public aspirations for improving cultural offer in the 3 towns appeared to be tied to aspirations of improved well-being. The barriers, again, to people engaging with culture were, again, seen in the literature. There's plenty of literature out there, and we didn't really find anything new there. The issues raised were around the big picture, perceptions of class divide, and institutional factors, education, for example, and individual factors such as economic constraints. In terms of funding and evaluation, there's quite a lot of really interesting data that came out of this. The cultural organisations are driven largely by economic-centred outputs. So they tend to use quantitatively oriented language. And so do to health. Unlike well-being evaluation tends to embrace more qualitative-oriented language. And this disparity was thought to need addressing. certainly in terms of building an evaluation tool. One of the issues that came up was how do we measure, what do we measure, and how do we find time to measure? So the issue of finding the answers to those questions was prioritised. Ultimately, the study showed that the 3 organisations make a considerable contribution to health and well-being, social capital in their communities. And so it's reasonable to assume that other cultural organisations across the country are doing the same. But as yet, this is undefined and unarticulated in any formal sense. In June last year, we were lucky enough to present our findings at the House of Commons with the support of Lord Alan Howarth and the then Shadow Minister of Culture, Helen Goodman. We gave a number of recommendations, and the recommendations really centred on partnerships, and it's something that both Baroness Andrews and Stuart have already spoken about. Collaboration between the sectors, between public, private, and third sector organisations, volunteer organisations, charities, and really importantly with academic institutions working with policymakers. And we have evidence of this agenda growing as we speak with all of the directorates now that are both public directorates and third sector directorates. And we're lucky enough to have Louise Mansfield talking a little bit later about a collaborative project that actually hits a lot of these buttons. We're currently in the process of writing a proposal to take forward our work, Nick Eubank Associates and the Sydney Tahar Research Centre, and we're working in collaboration with the Arts Council and a number of key funders who are interested in this field. So we're hopeful that this is just the beginning of something really quite wonderful. Thank you very much for listening.